everybody. We're just getting set up to do first vet exams with Dr. Ferguson. So, oh, it's the wrong camera. Shoot. Okay, hold on. You all know Dr. Ferguson.
Good morning.
I should have warned you
that it was coming.
Angle. The up the nose.
Put it back down on the beautiful kittens.
That's Dr. Ferguson from Mountain View Veterinary Hospital in Langley, and she is here to do first vet exams for Kittens and Eve, and hopefully Sloanie's kittens. We'll see if we can get them out.
See how things go.
Yep. Yeah. And so,
you start with Izzy? Or no, sorry.
This is Aurora. We could start with either though.
No, we can start with Aurora.
We did girls first.
Very good. Good morning, Aurora.
Do you want? Let me get you something for your knees.
I'm actually just good. This is how I spend my day.
Okay, but I have. Look, this is a. Oh, that's better, right?
That is very much more plush than I'm used to. Hello, good morning. You're very beautiful. So usually what I do is I'll start from head to toe, and we're just going to look and make sure that these guys are all growing the way that they should, which I'm sure they are, and then we don't find any abnormalities as far as their eye development or their palates or their heart, which is really, we're not expecting anything abnormal because Shelly's very good at letting vets know when things aren't normal, but we're just going to have a little peek and make sure. So now that they're 3 weeks, their eyes are open, which is good. Can I peek in your mouth? Is there little bits of teeth yet? Little bit?
Teeny,
oh, yeah.
tiny.
Little bits.
Teeny,
very good. You have a nice mouth. Very good. And feel her lymph nodes.
Do you like her little Yoda ears?
They're awesome. Oh, hey, what a mean vet. Good morning.
They're 3 weeks old today. So cute.
Oh, moving around just like you should.
Do you want me to hold her?
She's doing great. And do you have any concerns with them?
Nope.
No.
The only one thing was Cyrus's one eye, and Izzy's got a little runny stuff, but nothing.
A little bit, yeah.
Nothing colored.
Good. Can I make sure? So far, no hernias.
That's good.
Can feel her right kidney, left kidney. I think I will spare you guys because we're not vaccinating today. We will spare you the temperature. How about that? We'll save it for when we vaccinate them.
Aurora approves.
Let's have a listen to your heart. About 220 beats a minute, which is totally normal for a 3-week-old kitten. And I don't hear any murmurs or abnormalities. And your lungs are clear, you're screaming. She's so cute.
She's very cute.
She's a keeper.
I think so.
Yes.
And she's almost tabby, except she has a few little tiny orange spots
Yeah,
on
because I'm gonna be a spicy Torby.
her.
That's what I have. Yes.
Spicy Torby. So Aurora is good to go.
Aurora looks great.
And we dewormed last week, so we're not deworming this time.
So
we
I will
don't
make
need to
sure
do
Shelly has
anything.
something very awesome to deworm for next week. But I think if we can, we may just try to deworm Eve.
Yes, that would be good.
Good morning, Izzy. But no green or yellow, right?
No.
Just sort of like crust.
Just a little
and stuff.
runny.
Yeah.
Yeah, just Izzy, and then Cyrus's looked a little pink, so that's why I was.
Because Eve has had a
watching
few
him.
crusts, right?
Yeah, she's had a persistent kind of in her right eye, just a teeny bit.
A teeny bit, yeah. And most of the time, what it is it's a feline herpes virus, which pretty much all cats in the world have been exposed to, and that we've seen that Eve has sort of carried a little bit. And usually it's very self-limiting. If they start to get a bit of a conjunctivitis or irritation, or any color discharge, then we put them on some eye antibiotics. But often, if it's not really and it's bothering them and it's just a bunch of runny eyes, putting them on antibiotics because it's a viral infection probably doesn't do any good. So why bug them if we don't have to? But I know that Shelly's been watching Cyrus, right?
Mm-hmm.
And that put a bit of ointment in. Because sometimes bacteria like to take advantage of the mouth a little bit. You're very lovely. Goodness. You couldn't be any more gorgeous.
She's very special. Look at your sister. There's your sister.
They're moving great, hey?
I know.
It's been a big week, huh?
Mm-hmm. They've been walking for like a week with their bellies off the ground. They're very advanced.
They're great nutrition and care.
Sometimes they fall over. And they have really long tails.
I think there must be some Manx genes at the colony head.
Yeah.
Because there are a lot of funny tails coming in with kinks and shorter than, yeah.
Yep.
There's some Manx genes over there.
Something.
Some kinky tail genes. Hello. So move the stethoscope on one side and the other because then I get to listen to different heart valves. Good. Your heart sounds good. Good morning.
Good. 2,300 people watching. Thanks everybody for tuning in.
Mm-hmm.
You can ask questions in the chat, and I will check the chat and see if there's any questions.
Good. Your belly's beautiful. Nothing. Hey. Good. And right now I just have my hand on my finger on, this is the right kidney and this is the left kidney. Just make sure that they're there. That's wonderful. And one of the cats through the shelter, we found out once that wasn't the case. So it's nice to to know that they're doing well. And you're good. You're very lovely. Are they big purr machines or not so much?
For their mom they are.
Yeah. No, I'm sorry. Maybe one day.
Not for you.
Until I get you lots of food one day after you're spayed.
Yeah.
And
then
will purr for
they will
me.
purr. I'll go get some boys.
They look lovely.
That is good.
Write down that Izzy has a teeny bit of eye discharge.
Here we go. Time for the
Oh, you're just trying to confuse me.
boys. I know.
Maybe if we start with Otto, I'll do well. You are so photogenic. I've seen you all over the internet.
He's very handsome.
He is.
This is Pip. Cyrus.
Pip is a little squinty in the left, eh? No? Or maybe it was just, he was giving me the stink eye.
Or maybe they were wrestling. They were just at the milk bar. Sometimes they claw at each other.
Come here, Otto. Hello, how are you today? It's nice to see you.
He's not sure it's nice to see you.
Oh, I will make it just short and sweet. Just like you. Very good. Look at your brothers.
Otto. He's funny. He likes to burrow under the blankets. He likes to be a blanket monster. Oh, there, now he's excited.
I'm getting over. Oh my gosh, they're awesome.
They are walking pretty well, aren't they?
They really are, yeah. They're not, and it, like no one's a little swimmer or anything like that.
Very impressed.
When do you usually start putting in, like introducing a teeny bit of food? This week, next week?
Probably next week.
Yeah.
I've never had any luck with
3 weeks?
Mm-mm.
Yeah. Well, and Eve's doing so well, right?
She
I
is,
guess you don't
yeah.
have to rush it for any reason.
She's feeding them quite well.
Good. You're cute. Good. Sounds awesome.
Oh, so someone asked, Rosemary's asking, how do they get worms if Eve is already dewormed?
Oh,
That's a good question.
Well, she wasn't dewormed. Two things is she wasn't dewormed, probably likely because she was a surrender to laps before she was pregnant. So you can do a little bit of, some deworming while they are pregnant. But the parasites hide away. They're very good at hiding away. So to deworm properly before she was pregnant, she would have had to have been dewormed for several times every 2 weeks, and then probably once a month for a couple of months, and then probably 4 times a year. And that just wasn't the case. And also because of how Mother Nature is, parasites are great at hiding away, and the hormones of pregnancy trigger them to be passed on to kittens and puppies. So that's just how Mother Nature and parasites work. So even if you happen to get puppy or a kitten from a really, really good breeder, good breeders absolutely still deworm. You just assume all puppies and kittens have worms, and probably with shelter animals, because their parents weren't dewormed properly at all, is probably just magnified. He looks lovely.
And so
let
you
me
can
actually just keep his belly one more time.
you can kill some of the worms, but so there could still be worm eggs, worm larvae. They could reinfect themselves.
Yes.
So that's why we do it on repeat.
Right, and because of the life cycle of the worm, that's why you repeat it every 2 weeks, because there isn't, for most, which is the primary type of parasites that you have both your boys. That's very good.
2 testicles.
Yay! Yay!
This is Pip.
Thank you.
Good job, Otto.
So for roundworms, there isn't one dewormer that gets every life stage of the roundworms. So you have to catch them at a certain stage to be effective.
Oh, he's excited.
He is so sweet.
Pip is so excited to meet Dr. Ferguson. We have been talking about you all week.
Oh my goodness. Hmm. Can I see inside your mouth? They do have really crazy ears.
I know. They're very special.
Where did that come from?
2,400 people.
Let's peek in there. I hope that answered the deworming question. Was it clear?
Yeah. I thought it was clear. You guys let us know if you have more questions.
And breeders, on top of doing all the, when people actually breed, before they breed their dog or their cat, they will actually make sure that the female is even extra dewormed.
Yep, worms do cause trouble. And there was a question about should you deworm your indoor cats even if they never go outside?
Ideally, the recommendation, the ideal recommendation is still 4 times a year. You have to talk to your veterinarian about sort of the risk in your house and if things have been done thoroughly up to a certain point, whether you have kids in the house. I know a vet who found parasites in her 17-year-old indoor cat. And she has no idea how it happened. So it can happen. And sometimes when we see patients that have ongoing diarrhea, intestinal options, or ongoing diarrhea and vomiting, before we start doing fancy tests, even if they're indoor, we just go ahead and deworm them safely. Just to cross that T.
Because you could bring home potentially worm eggs, larvae, like if you step in
Well,
some
and I think
poop or
possibly
if you-
from like houseflies and things like that, catching little bugs. Parasites hiding away and then shedding. And yeah, we can bring them home to a
Kittens.
You coming back, Otto? Coming back?
He says that looks like fun. I want more.
So awesome. Good. Come back to me. I know. You know them way better. So 2 kidneys, 1 there, 1 there.
That's excellent.
They're very curious. Your belly looks good. I'm having a gentle sort of feel of their knees when they're sort of letting me to make sure their patellas don't luxate. I'm not seeing anything super obvious, but we'll check again later.
That's nice for a change.
Hello. Hello, I know. There you go.
Does he have 2 testicles?
He does. You should. He's also a keeper.
Good job.
And his heart sounds lovely.
Good.
His abdomen feels normal.
Great. That's excellent.
Are you going to come and see me, Pip?
Here's Cyrus.
Cyrus. Oh, sorry. I'm going to get Pip and Cyrus mixed. Because you have white.
A lot of people do.
Yeah,
And
he
so-
does a little bit of crossing. It's very little, though.
Yeah, it's gotten better, and it was red, so that's kind of why it seemed like it was a little more. But it's gotten better. I've been doing the drops.
He's got bigger teeth. You can see his little canine sticking through.
He's ready.
They all have pretty good smiles, I think. Oh, he might actually have a teeny underbite. Keep an eye on that. See? His top jaw is a little bit behind his bottom jaw. Are you going to have a funny smile? That would be very charming.
Very charming.
You teach your new owners how to brush teeth. Oh, you should always brush your teeth anyways, but... let me just see. Let's see, maybe nothing really comes of it. His is perfect. So if you look at Otto, he's got a very perfect bite. His top jaw is a teeny bit in front of his bottom. Yours is a teeny bit behind your bottom. You might have a funny smile. His is almost
almost on top.
And his is a little bit behind.
Oh yeah, interesting.
Yeah, we'll have to keep an eye.
Oh, special. Special kittens.
Oh, he says, I see that now. I'm more than 2 weeks, I can see that. And it's freaky. Good boy.
Good job.
I can't see any weird. Okay. You haven't seen anything?
No.
Pupillary membranes, or these ones are very clear.
No, I know. These ones were good.
No crazy irises.
Yeah, they had good nutrition, no flea collar on Mom.
I guess, yeah. I haven't seen a flea collar come into the clinic in years, which is very lovely. So,
Yeah.
yeah, I guess they're still out there.
Oh, he's gonna get ya.
Okay, there we go.
Good job, everybody.
I know. Show me your belly. Show me it.
Good.
Good job. You're very lovely. 1, 2 kidneys. Can I see your belly? Good. That's nice. 5 for 5. Other than maybe a little bit of a gently crazy smile.
Gently crazy.
Yay. It might correct. We'll see.
Did the girls look?
They looked more, yeah,
Fine?
they looked, yeah, I wonder if I should have a super quick peek again now that
I'll bring them.
it's super subtle.
The transport. Oh my goodness.
Sorry, ladies. Sorry, ladies. Let's have it closer since it was so subtle with your brother. No, you know what?
Does Rory have it too?
Teeny bit.
Oh my goodness.
We have another one. Can you see that?
Yep. Oh, special.
One more. I know, it's sort of a weird thing, isn't it?
Mm-hmm.
Mean bit. Yeah, actually, she's teeny underbite.
Teeny little special face.
I know it's hard and I'm such a meanie. I always want to. Oh, thank you. Yeah.
She's being trouble.
Well, it's a weird thing to do. Hers is more even, what we sort of call like a scissor bite. Hers is a teeny bit under too.
Oh, so cute.
We'll see. It's so subtle.
But as long as the teeth are inside the mouth and everything, it's not going to cause any issues? Or is there
Yeah, and
any
it's-
sort of concern with that?
If they have significant underbite and it's or an overbite, what can happen is the upper teeth or the lower teeth can start growing into the palate,
Oh.
and then it can almost act like, and then it sort of gets into that tissue. It can cause irritation on the if they're occluding with the membranes where they're not supposed to. It can injure the gum tissue. And then sometimes it gets locked into there because it finds a nice place to seed, and then it acts like a bad pair of braces, and it makes the situation worse.
Yeah, yeah.
That's what we were watching for with Marvel.
Yeah.
With his palate and his teeth coming in maybe a teeny bit crooked, that they didn't push into the tissue and it didn't hurt him, or that it didn't cause any and it didn't for him, which is good. And cats are way luckier than dogs, that they tend to have way better teeth genetics. So it's probably going to be just fine, but it's something that we'll keep an eye on, you know, and in the big scale of things. So I have, and with other patients and with some puppies that were born at lapse, we actually took some of their baby teeth out early, so it gave their adult teeth a better shot at coming in correctly, and it helped. So at their spays and neuters, we just helped some of their baby teeth come out a little bit early, so that they ended up with the best type of mouth possible. So it's not like it's a huge deal in the long run, and probably with these guys it's going to be no deal at all, but something just to watch.
My first cat that I ever had was a Persian, and he had an interbite, and his teeth were on the outside.
Yeah.
Yep, his teeth were outside.
And cats also have such little incisors. It's different than dogs, so it doesn't tend to. They don't tend to go into their palate.
Too close. All right. Well, very good. Thank you. So I'll bring Eve out.
Okay, cool.
All right. Good job, girls.
Hello, gorgeous. How are you?
She gets a little nervous sometimes.
Do you think you would have better chance feeding these pills later to her?
Maybe.
Okay, so I'll just leave them.
Yeah, that's fine, because she gets a little.
I'm sorry. You're so
a little
busy.
nervous.
I don't blame you. Let's just have a wee peek and make sure that you look super lovely. Do you have that crazy mouth too that we didn't notice before? Very good. Say ah. I'm gonna scale your teeth when you get spayed.
Oh, you have scaly teeth.
You have shiny teeth to go to your new home. We should do that. It'll be a little present for you.
Oh, that would be so nice. She's got. I tried to ferminate her, and she's not super into it. So
She might be
just
very
sheds.
busy grooming kittens right now and not herself.
I know. I tried to help her out, but she was not super into it. What a good girl, though. What you looking at? Oh, and she has in her left eye. You see, there's like a little.
Oh yeah. Scar probably.
Yeah, because it's been there the whole time. At first,
Yeah.
I thought she just had something in there, and
Yeah.
but it's been there the whole time, and it doesn't seem to bother her, and it hasn't grown.
Yeah, it's not inflamed. If something's inflamed, you can see sometimes at advanced stages, been there for a long time, little tiny blood vessels kind of making their way there to heal something, and it's very quiet. It's something that's happened to her before you.
But that's good.
It's right on her cornea. I won't bug you too much about it. Doesn't worry. When you come in and you care not so much about your kittens, we'll have a better look. But I don't think it's a big deal. Can I peek in your ears? I'm sure they're lovely. We did this before, and you've had revolution.
Yep, she did. She's
Yours will
had.
be easier to bend over. My back isn't great for the hair. Good.
Good girl. What a good girl. What a good girl.
Your mammary glands feel good.
She had kind of a tough time getting started with the nursing.
Just lactating?
I wonder if just was kind of sore.
Oh, right. I remember there was
Mm-hmm.
an ouchie picture.
Yes. Or I wonder if their bites. I wonder if their bites affect the way
They sort of
nurse.
suck in the wrong place.
Maybe.
Or
Maybe.
oh, it's okay. I won't stay long. I won't stay long with you, Eve.
Good girl.
We have listened to your heart a couple of times.
Good girl.
Or more. You look lovely. Remind me that I want to do your teeth, Eve. Will you remind me of that?
Mm-hmm. Thank you.
And no more discharge right at the back
Nope.
edge? Good girl. That's how it's supposed to be.
Yeah.
There. She's good.
Thank you. That is
lovely.
good.
I won't irritate her too long. I want to stress her out.
Good job, little mama. There you go. Good girl. All right, so clean bill of health for everyone.
Amazing bill of health.
That's great. Now, do you have time to look at
I
Sloanie's
do.
babies?
I do.
Okay.
Of course.
Yeah, as long as she's not in the nest with them, I can probably grab them.
Do you need
Which is good.
probably not help?
What?
So probably better if I don't help you, or is
Yeah,
it quick?
you can't go in there because I don't want you to get your arm bitten off.
No.
And I don't know if you want any precautionary garments. This is all clean, even though it looks folded and not folded. But I do have some lab coats and stuff. I should have given you one before Eve because she's so fluffy.
Oh, it's okay.
And now you're fluffy.
Oh,
Dr. Ferguson has given up her holiday to come out and do exams for kittens, so
oh, it's perfect. It's perfect.
she's very awesome.
My kid with their dad, we deeped inside for a couple super while.
And it's so nice, but it's so nice. Still, we really appreciate it.
They don't even know I'm gone.
Thank goodness. Watch out for the random cords strung everywhere. Hanging everywhere. Okay, I'm just gonna run in and grab, I don't know, a pile of things.
Have these guys been dewormed?
No,
Are they too?
they're 1 week. 1 week.
Oh no, we can't. Yeah,
So-
I will help you with it though if you want.
Okay,
But
and
yeah, 2 rooms.
yeah,
And
so,
this one we're going to do this one.
so I'll be back. So Sloanie's kitten's up next. I'm just gonna go in and grab them. It just takes a minute to get dressed. Just taking precautions because we know they have upper respiratory infections out there at the feral cat colony, so trying to keep Eve as healthy as possible.
We're trying to figure out what they have. We've sent a few samples off to the lab and they keep coming back negative, but we're like, that is not possible because we can see they have an infection. But for the common things, they're coming back negative. So I sent one off again a couple of days ago, so we should get it in the next couple of days to find out what is going on in that colony. So.
You are. Spider. All right. Kittens have been extracted. Grab the scale.
Wow, you are good.
I got all of them. I can weigh them. 2.
Do you want me to write that down?
Sure. Just to make sure they're all gaining. Okay. This is Badger. He's very ferocious. 221. Okay. Katie's 187. Junebug 201. Cricket 186.
Awesome.
I think that's up from yesterday. basket of kittens. There's a basket of feral kittens for everyone to look at.
And they're going to go into pet homes?
Yes, yes. So these guys will definitely be able to be adopted out.
You don't have ears or eyes, am I right? Well, you do. They're just closed right now. The world doesn't care. Hey, you just care about your mom and your nose right now. Can you say ah? Oh, very good. Very ferocious. Lymph nodes.
So, and a couple of them have nose discharge. So I've been trying to, oh, and there's some eye discharge, even though we don't have eyes.
Yeah.
But, so I'm just trying to, I don't know, I'm giving Sloan, the mom, lysine every day.
Yeah. We'll just make sure it's not colored. And the other kittens that have come from as soon as we have seen any colored stuff, even though we haven't been able to isolate it, we put them on erythromycin and it goes away.
Okay.
So I'm hoping in the next 2 days we actually find out more about the bugs. The type of infections that are up there, we will try again. If not, what we're doing is working, we just don't know what it is that we're fighting. Probably herpes and something else. Well, obviously, because we're getting a bacterial.
Sloaney had eye discharge that looked herp-like. Just in one eye.
You have a good little heart. It's very adorable. Okay. Oh, you're so cute. Okay. I won't keep you guys very long from your mom. You're a good girl. Your heart sounds great.
Okay, good.
Your kidneys are good. Your abdomen's good.
I was a little worried the first time I grabbed them because they went really quiet and still, and I was nervous that meant that, you know, they weren't doing okay. But then I thought maybe because they're feral, maybe it's a predator response. I don't know, because they are very quiet compared to other kittens I've had.
Maybe, hey? They
Or it could
probably
just be
would just have to, it'd be bred that they can't be noisy. Because noisy kittens probably don't do well out in the wild.
I know.
It is clear though, hey? Which is good.
Yep.
Two kidneys, one there, one there. Yay. Can you feel them yet?
Yeah. I can
feel them and bladders and stuff.
Yep. I feel kidneys. I can't always feel the bladder.
Sometimes it's little. Sometimes I can't feel a bladder either. They come in microscopic. Empty.
So these guys are a week old today.
They're so good.
Very cute. So I'm trying to handle them as much as possible whenever I have the opportunity, just to get them used to it. Hi. You're very wet nose.
You're very special. We don't see very many kitties like you.
I know, I'm interested in how that happened, because even if it's a recessive gene and only 2 cats have it, you would expect that there would be more kittens like that, right?
Yeah. Here we go.
Bless you. Uh-oh, sneezes. Alright, how about this is Junebug.
That was Junebug.
And I saw a question in the chat about, I'm just wearing gloves because I have kittens over there that are susceptible to whatever these guys might have, and since we don't know what it is, and since I go back and forth throughout the day, I'm being extra careful.
And after this, I'm going to wash my hands and I'm going to go. So I'm not going to work today or anything like that, so I'm going to wash my hands and out. Shelly's in and out between the two of them, so we worked from the cleanest litter to potentially what we call the dirtiest litter. So then I get to go after Shelly gets to keep being a nursemaid.
That's right. So I'm kind of being overly cautious, just until we know what it is and whatever, just because Eve's babies are doing so well, I don't want to put them at risk. And I've also been handling ringworm.
Yes, I have. Is that her little tail? You're so cute. She does have adorable babies. So hopefully we can keep peeking at them when we see Eve's kittens.
That would be nice.
Yeah, that they don't get too feisty, or Sloan doesn't get too feisty and lets us peek.
If she's in the nest, there's probably no way I could get them. But if she's not in the nest at the time, then she does not come after me.
They look awesome.
Yet.
They look really awesome.
Oh, good. I'm relieved.
I mean, look at you.
I've been worried, just
Because
academically.
No, well, I think several reasons. I think it's nice that we get to look at them. I always find when the kittens from your foster care come in, because I've seen them before, so I know that their hearts are good, their lungs are good. So it's not a surprise. We're gonna unveil some hiding abnormality right before adoption, and also especially with your kittens, if so many people fall in love with them online, and sometimes they, not every animal is born perfectly. It's just nice to know what we're up against. And it gives a chance also, Shelley fosters obviously kittens, but part of what she does is educate, and it gives a chance to educate when you get to examine them also.
Yeah, hand sanitizers and Purell and stuff like that is better than nothing, but it's generally, we don't consider that effective against the cat viruses, and definitely not ringworm. So we don't rely on things like that to keep us clean.
There are a whole bunch of protocols for disinfecting properly against ringworm. And there's, for different types of chemicals and disinfectants, there's different contact times. There we go. Yay for you. This is sweet.
Does he have 2 testicles? Can you tell?
Oh, it was kind of just a bunch of
Stuff.
Yeah. I wasn't going to be too mean. I think he does, actually.
Oh, he's very manly.
I'm optimistic. He's like, they're gone now. I'm hiding them from you, wicked lady. I think there is 2. I think there is 2.
He went right back to sleep.
Had you not found them, or you had?
No, I hadn't actually thought to check, because I've been doing so fast. I've been going so fast in there to try to not stress anyone else.
Do you want me to? There's 2 boys, no?
I think 3. I think three girls is what I mean.
Yeah. Okay. Yeah, I saw that, and I remember that.
I'm pretty sure they're all these guys.
Yeah. There we go. Just one lonely boy. Oh wow.
He's gonna have a.
It's good to be raised with sisters.
3 sisters.
Then you will always understand women. Hey, there you
go. All right.
They look awesome. Like, really, even their body condition is amazing. So that's lovely.
I was very lucky that Sloanie's taking good care of them.
Yeah.
that was definitely a risk.
Wow. But they look amazing.
Okay, good.
Yeah, I think they look like super healthy 1-week-old kittens.
Awesome. That's good. Well, thank you so much, Dr. Ferguson, for coming and spending your holiday with kittens and answering questions. Does anyone have any last questions? Cats can sometimes only have, they have 1 hidden testicle. Can cats have just 1 testicle? I suppose they could.
They could. They probably only have 1 kidney, because embryologically the testicles develop from the similar tissue to the kidneys. I have never seen it. They have 2 testicles. Shelley's right. Most of if they only see 1 testicle, it's because the other one is hiding in the abdomen. And those are the super important animals to neuter, because they're high risk for cancer. And also 1 testicle in the scrotum is called cryptorchism, and those patients are much higher risk for cancer, and it's hereditary. So if they breed, their offspring will have one testicle too. So you want to for sure make sure those ones get neutered.
2 testicles, important. What do you use to sanitize your doctor instruments?
Oh gosh. We use lots of, depending on what type of instruments they are, and what kind of diseases. We have a whole spectrum of disinfectant. Our instruments themselves, they are scrubbed down with surgical cleaner, and then they are rinsed, and then they go in an autoclave. And that's where our instruments go. Our tables and stethoscopes and things get cleaned with either clinicide or proxyguard. I do use bleach sometimes for when there's been ringworm around at certain percentages.
Let's see. I didn't see anything else. How will you get Sloan to be spayed? Oh well. We'll cross that bridge when we come to it.
It will be okay. We have, there's lots of, because so far, I don't know how many there's been as far as from the colony for spays and neuters, probably quite a bit.
52.
We found some, at least at our clinic, and it's probably going equally as well at other clinics, is some great sedation techniques where the animals are very relaxed and not stressed. They're sedated right away.
Could I give her something in her food and then?
Yeah, absolutely. Because this is a special. Yeah, there's a lot of things we can do to minimize stress for her, and she just will wake up spayed.
That would be awesome. Yes, trying to minimize stress as much as possible since Sloanie is feral.
Yes. Well, we always try to minimize stress anyways. It's a safer procedure when they're not stressed, and it's an easier procedure when they're not stressed.
Sloanie is not getting an exam today because she's feral and she's very ferocious. I can't handle her. I can't get close to her, especially when she's in protective mama mode. So I like Dr. Ferguson with all of her fingers.
Yeah, and it's probably not the best thing for Sloan. I mean, it would be, but she's not going to go to a home. She's going to go back to the colony, is she not?
Mm-hmm.
And when she's sedated before her spay, as all of the ones from the colony, we've been examining them and making sure there isn't anything that we need to help with at that time. But completely stressing her out is not going to help her right now. She needs to stay calm and take care of her kittens.
Good answer. All right. Dr. Renee Ferguson from Mountain View Veterinary Hospital, mvvet.ca. Everyone thank her for coming out on her holiday and spending so much time with us and helping with the kittens and making sure they're okay and all that stuff. So thank you, Dr. Ferguson.
My pleasure. And thank everybody for watching and supporting Tiny Kittens and Labs.
All right.
Awesome.
I'm going to switch the feed back over. Get one more look at the these are ferocious little feral kittens. They'll be available for adoption in about maybe 8 or 9 weeks. We'll see how big they get, how fast. But I was thinking, and I know you're going to give me a look for saying this, but if they're healthy by the time Sloanie goes back, do you think how horrible would it be to try to put them in there with those guys? They'll be 6 weeks, they'll be 4 weeks or 5, 7.
I think we'd have to see as far as like any viruses and stuff that come up to play.
Yeah.
I'm always completely worried that because Sloane's probably never been vaccinated in her life.
Yeah.
What she's got hiding and things, and there are ways, and also it's going to be 4 or 6 weeks on your watch with all these kittens. Is I just don't want one group of kittens to make another group of kittens. But I get the benefit for sure.
Yeah,
I think it'd be socialization.
Yeah, to see a mom and to have other.
And maybe just take a little bit more of the feral edge off them before they go to homes.
Yeah.
And we maybe should, then we can do things like feline leukemia tests or do things like that.
And we would do that around 8 weeks old typically for feline leukemia for kittens?
Yeah, unless we have an indication that things aren't going well. But yeah, sometimes we can do it earlier, but usually 8 weeks is a good time to do it.
Excellent. Thank you.
Thank you.
You can give me that.
Thank you.
All right. So I'm going to switch the feed back over, say goodbye to the ridiculously adorable Sloanie kittens. And you'll be going back to the Eve cam.